Hi, my name is Almaz Desi. I'm going to be talking to you about point-of-care ultrasound of the bladder. There are several indications to perform a POCUS of the bladder. The first is to evaluate for urinary retention by assessing pre- and post-void bladder volume. The second is to evaluate for ureteral obstruction, usually from a kidney stone, by looking for ureteral jets in the bladder. Finally, the bladder can be assessed using POCUS prior to performing certain procedures. This includes assessing bladder volume before performing urethral catheterization of infants to be sure you have adequate volume to get a urine sample. Bladder fullness can also be assessed to determine if female patients have adequate volume of urine in their bladder to successfully visualize their ovaries for radiology-performed transabdominal pelvic ultrasound. For bladder ultrasound, you will usually use one of the lower frequency transducers, either the curvilinear or phased array probe. In small infants, a high-frequency linear probe could be used, but the phased array probe is usually sufficient, and it tends to be preferred in children of all sizes due to its small footprint. To identify the bladder, place the probe just above the pubic symphysis in the midline of the patient's abdomen. In the transverse orientation shown here on the left, the probe marker is oriented to the patient's right side. The probe should be directly above the pubic symphysis and angle slightly caudally towards the patient's feet. A second view is obtained in the sagittal or longitudinal orientation by rotating the probe marker up towards the patient's head and again rocking or fanning the probe towards the patient's feet. If you're familiar with the FAST exam, these views and orientations are identical to the pelvic views obtained in that exam. Let's talk about the scanning protocol. So for bladder volume, first you'll identify the bladder in the transverse orientation I just described. You'll fan through the bladder to find where it appears the largest. Freeze a still image of the bladder there, and use your calipers or your machine's bladder volume calculation tool to measure the bladder width. You will then identify the bladder in the longitudinal or sagittal orientation and take an additional measurement of the bladder height. The bladder depth can be measured in either orientation and should only be measured once. So pick whether you're going to measure depth in transverse or longitudinal. It doesn't matter, you'll get basically the same measurement. This is one of the easiest POCUS applications to learn for this protocol. It's also super fast to perform, with studies showing it takes on average less than 2 minutes to calculate a bladder volume, even for novices. Here's an example of the transverse bladder view. Note the depth here is set to 10 centimeters, but you may be as shallow as 5 centimeters or as deep as 12 centimeters, and that depends on the size of your patient. But the goal will be to adjust so that your bladder is in the center, kind of upper 2/3 focal zone of your ultrasound screen. Now the bladder here is central on the screen. It's an anechoic fluid-filled structure surrounded by echogenic walls. The shape can be trapezoidal, rectangular, or ovoid depending on the degree of bladder fullness. Here, a transverse measurement is obtained of the bladder width, so that is left to right on the screen and also left to right across the patient's body. It's marked 1 on this image and measures 5.65 centimeters. Here is an example of the longitudinal or sagittal bladder view. The probe marker has now been oriented up towards the patient's head. Here a measurement is taken of the bladder height, meaning cephalad to caudad, head to toe. And that corresponds to a measurement marked here as 2 from the left side of the screen to the right side of the screen in the longitudinal orientation. Additionally, the bladder depth is measured here, meaning from the front of the patient to the back of the patient, from your probe to the bed. And that corresponds to a measurement marked 1 in this image from the top to the bottom of the screen. Again, bladder depth can be measured in either transverse or longitudinal orientation, as the bladder depth is visualized basically the same in both. I personally just prefer to measure depth in this orientation. Calculating bladder volume. So there's a couple ways to calculate the volume once you've obtained these measurements. Most newer machines have a bladder volume function that will automatically calculate the volume based on the 3 caliper measurements I just described. But if for some reason you aren't able to use that function or you don't have it, you can estimate bladder volume by multiplying bladder width by height by depth and multiplying that by a coefficient that approximates the bladder shape. Several different coefficients are used in the radiology literature based on whether the bladder is kind of ellipsoid or trapezoidal or cuboid. But for the sake of simplicity, a standard coefficient of 0.7 can be used to get a fairly accurate bladder volume estimate for most patients. So you'll do width times height times depth times 0.7. These measurements will typically be far more accurate than bladder scanners, especially at small volumes. Specifically for infants who are undergoing bladder catheterization, there is excellent literature to support volumetric bladder ultrasound before you do this procedure. This can decrease rates of dry cath significantly. A bladder volume of 3 mL is sufficient to successfully collect 2 mL of urine from an infant for urinalysis and culture. Another study also found that rather than calculating the full bladder volume, a single transverse bladder width measurement of at least 2 centimeters was sufficient to collect enough urine for testing. Next, we'll talk about ureteral jets. Obstructing nephrolithiasis can cause ureteral obstruction, and this can be evaluated for by assessing bladder urinary jets on POCUS. You'll identify the bladder in transverse orientation as we previously described, and then you'll apply color Doppler to the inferior medial portion of the bladder, and then wait to see if you see jets on both sides. Normal ureteral jets occur sporadically, and often they don't appear on both sides at the same time, so you can expect to wait up to 5 minutes for a urinary jet to appear on each side before you can conclude that an obstruction is present. Here would be normal findings. You can see the bladder in transverse orientation and the colored Doppler box applied to the inferior medial bladder. You can see the urine jet is coming from the ureter as a flicker of color towards the probe from the left and then from the right portion of the inferior bladder. This is a normal bilateral urinary jet indicating no urinary obstruction. The last image showed you that sometimes you can apply the color Doppler across the entire bladder to visualize jets bilaterally at the same time. But depending on the bladder size and your color Doppler box settings, it can be easier sometimes to just look at one side at a time. Here you can see the bladder in transverse orientation again, and the first video shows color Doppler with the box applied to the patient's right, so we are assessing for right-sided urinary jets. Then the color Doppler is moved to the patient's left to assess for a left-sided jet. Here a jet is visualized on both sides, so it's very unlikely that the patient has ureteral obstruction.
Stop, look, and listen. There's a bright mass inside of the bladder next to the arrow. The color signal here is not the same as the other normal urine jets. A biopsy was consistent with a bladder carcinoma.
I'll mention a few pearls as you work on your bladder POCUS skills. First of all, the bladder is very caudal. It's a low structure in the pelvis, especially when it's not very full. So if you're having trouble finding it, you may have to expose more of the patient's lower abdomen, and even then try rocking or fanning your probe more towards the patient's feet. When calculating bladder volume, it's essential to fan through the entire bladder in both planes. You want to be sure you are freezing an image and taking your measurements at the widest points of the bladder to obtain accurate measurements. Finally, urinary jets can take several minutes to visualize and always seem to take longer when you're looking for them. Both sides should be examined, but if you're short on time, you maybe want to focus on the side of concern. So if the patient presents with unilateral pain or has unilateral hydronephrosis, focus on that side. You should also have one hand on the clip button on your machine to make sure you capture the jets as soon as they are visualized, as they may be only a flicker for a few seconds. Here you can see I'm slowly fanning through the bladder. At one end or the other, the bladder can look quite small, but in the middle, the width and depth are much larger. That's where I want to take my bladder volume measurements. This is a fairly easy POCUS application compared to some others, but I will mention one pitfall, and that is just to be aware of other things that can be mistaken for the bladder, like free fluid, ovarian pathology, or other fake outs, maybe congenital anomalies like a ureter or seal. Those things can be mistaken for the bladder, so it's really important just to fan all the way through in both planes to make sure you're identifying the correct structure. So here's an example of this. Here you see two fluid-filled structures in the pelvis. If you don't carefully fan through this area, it would be easy to mistake the second structure as the bladder. But if you carefully fan through, and you have a knowledge of the typical shape of the bladder, that allows you to identify that the first visualized structure is the bladder. And the second visualized structure is actually a cystic mass coming off of the ovary. I'd like to conclude with a case. A 6-week-old term-healthy infant comes in with a fever but otherwise well appearance and normal vital signs. Nurses have trouble obtaining blood, and this requires multiple attempts by 2 nurses before successful samples are drawn. A bag urine was placed at triage, and that urinalysis comes back positive. We go back to explain to the parents that a catheter urine sample is now required. They express concern about the baby being poked again multiple times for more testing. You remember this lecture, and you offer to perform a bladder focus to ensure adequate urinary volume is present before attempting a cath urine. Here are the images you obtain. Based on these images, do you tell your nurses to proceed with the cath or to wait? The answer is to perform the cath. A total of 24 mLs are present in this infant's bladder. That is plenty more than the required 3 mLs to ensure high likelihood of a successful cath. You might also remember I mentioned that greater than 2 centimeters width in the transverse orientation also predicts a pretty high likelihood of a successful cath. In the transverse view on the left here, the bladder width measures 4.3 centimeters. So even based on that single view and measurement, you can feel confident that this will be a successful catheterization. So to summarize, you should consider POCUS in any scenario where you're interested in assessing bladder volume. Either pre and post void for patients you're concerned about urinary retention, or before you perform an invasive procedure like urine catheterization with infants. For bladder volumes, make sure you fan through the bladder to find its largest area and take 3D measurements in 2 orthogonal planes. Overall, this is an easy application for people to learn. It's fast to perform, and it's super useful clinically. Thanks for listening. Again, my name is Almaz Desi, and my email is listed here if you wish to contact me. And thanks as always to the P2 Network for helping spread the awesomeness that is Pediatric POCUS.